So the reason you want to come to a dermatologist for your cosmetic treatment is because they're going to look at your face and your skin in a global way. You don't want to just fix one thing, you want to treat your whole skin. And so my philosophy of aging is that there are three main components. So the first is gravity. Everything drops with time, so we have to try to reverse that. The second is volume and structure. So as we age, our cheeks flatten and we lose volume. It's kind of like a grape that shrivels into a raisin. And the third component would be the quality and texture of skin. So this would be your brown spots, your fine lines and wrinkles, your red spots. So you don't want to just treat one thing. It's kind of looking at the patient in a global way. However, there is something called an age-defining feature. So there's usually one thing when you look in the mirror that gives away your age, and it makes sense to fix that. So that's why you want to come to a dermatologist or a skin expert. You want to get that advice and make sure that you get natural, youthful results without changing your overall appearance, just looking more refreshed and looking the way you feel. During my surgical fellowship, I not only performed thousands of cases of skin cancer surgery and reconstruction, I also learned how to do cosmetic surgery under local anesthesia. One of my main interests is creating a very youthful eyelid. And so I do perform upper eyelid blepharoplasty or eyelid tucks under local anesthesia. This is a very safe procedure with high satisfaction because it only takes an hour to perform, and you are awake during the procedure, even though we do give you medication to relax you, which requires a driver to take you home. Oftentimes, the eyelids can make you look tired or sleepy, and by performing eyelid surgery, you can look immediately 5 to 10 years younger. The downtime is minimal, so that you actually have the sutures removed in 6 to 7 days after the procedure. And after the swelling and bruising is gone, usually by 2 weeks you look back to normal. So I also perform neck liposuction or liposculpture under local anesthesia. So basically we plump up the neck with about a Coke can full of lidocaine mixed with saline and allow that to numb. And there are 3 small entry points on the face which allow us to insert a cannula and loosen up and suck up the fat. And that actually allows the skin to tighten also. So it's a very easy, short downtime procedure where you wear a neck brace for about 3 days. And after the bruising and swelling is gone in a week, you're back to normal. Here at the Laser Skincare Center, we have a dozen devices, the most between UCLA and the Beckman Institute in Irvine, that can treat almost any skin conditions. So, for instance, we have devices for red spots, the blood vessels around the nose and rosacea. We also have a pigmented laser for brown spots, melasma of different types. So we have ones that have minimal downtime or up to a week of flaking and peeling. We also have a tattoo removal laser. We also have lasers that can treat acne, precancerous lesions, vitiligo, psoriasis, and other cosmetic procedures, including the Ulthera device, which is a minimal downtime face and neck lifting without any incisions. This can also lift your eyebrows about 2 to 4 millimeters. Ultherapy is a device that can provide tightening and lifting of the skin and even help with the fine lines and wrinkles. It can treat your face, neck, and even the chest and décolletage area. So depending on the patient's skin, there are different settings which you can use. And it's really important with Ultherapy to understand that a physician evaluating your face and providing adequate pain control is key to maintaining results as well as achieving the best success. There are people that are non-physicians and non-dermatologists performing Ultherapy, but they may not be able to analyze your face or provide you with enough comfort during the procedure to make it the best results possible. So it works with ultrasound. So the patient has no cutting or sewing involved, but you can get lifting of the neck and jawline area, tightening of the jowls over time. The way it works is ultrasound is used to deliver energy to the SMAS, which is the level right above the muscle. It's the same area that's tightened during a facelift. And because that energy is delivered, your body then produces collagen and tightens. The results usually take 6 to 12 months to see the final effects. People often ask me, how many times do I need to perform Ultherapy? And the answer is, it depends on you. When you have an Ultherapy procedure, it builds collagen, so the collagen that you make never goes away. However, you continue to age, time continues to march on, and gravity continues to pull the face lower. So in general, it's a one-time procedure and people will not repeat it sooner than 6 to 12 months. However, if you see some benefit, if you do it again, you can see even more benefit. So Botox is different than fillers. So Botox helps with muscles of dynamic expression, meaning with movement. So as we get older, we tend to overexpress. We frown deeper, we raise our eyebrows really high, and these create wrinkles that a lot of times people feel can make them look angry or tired or sad. And so you can use Botox to soften those lines. Fillers are used when those lines are fixed. So there are different types of fillers. There are thin fillers that can go right to the surface and treat those fine lines and wrinkles around the eyes or lips. There are thicker fillers that last longer, 6 to 12 months, for the deeper wrinkles around the mouth to outline the lip, even under the tear troughs to make you look more awake and refreshed. And then there are also longer lasting fillers, which you can place in the cheeks to lift. And those can last even longer because they promote your own body to build collagen. For instance, Radius, Sculptra, they can actually create collagen, which can last years. There are different types of products that can be made into fillers. The most common is hyaluronic acid. It's a substance that your body naturally makes. And for instance, Juvederm, Restylane, Perlane, Voluma, those are all types of hyaluronic acid fillers. And the reason that is nice is because there is an eraser for it. For instance, if you decide that you don't want that look, it can be erased. That often happens when patients are referred from other offices and they need adjustments. Luckily, there's an eraser for those fillers. Voluma lasts longer, so according to the FDA, it's been approved for up to 2 years, depending on optimal correction. So for hair removal, we have the Cynosure MPX Elite, which is a state-of-the-art laser that can treat all skin types. That's exciting because patients with darker skin tones, such as myself, can often have complications with lasers. So this laser can customize your treatment for your skin tone and to minimize potential complications. So laser hair removal targets the hair follicle. So depending on your skin tone and skin color, you have to choose different settings. You can use the Alexandrite laser or you can use the Nd:YAG laser, but in the end, the laser targets the hair. And the interesting thing is that the hair you have today is not the same hair you have in 4 to 6 weeks, which is why laser hair removal is usually a series of treatments. So one thing that frustrates patients are acne scars, and you should come to the office for an evaluation of your acne scars. Acne scars can come in the form of pigmentation or actual divots in the skin, rolling scars or ice pick scars. We have treatments for those. Not only do we have lasers, we have bleaching creams, as well as a procedure called subcision. So it is an intervention where we actually use a blade at the end of a needle to break up the scar tissue to pop it up. It's relatively painless after we numb everything. So I think having beautiful skin and feeling good about the way you look is important. We all do things such as get our hair done, get our nails done, and it's a maintenance. So I think that coming to a dermatologist, having a consultation to see how you can improve your skin is important. And to think about Botox and fillers and other procedures as maintenance to provide the best look to your skin makes sense. So acne can be treated in a number of different ways, and we actually not only provide topicals, but do prescribe Accutane, as well as the fillers, lasers, and resurfacing procedures to treat the scars. So it's really a full service approach to acne as opposed to just throwing a couple prescriptions every few months. I think you can really improve someone's self-confidence and outlook on life just by helping them with a condition that's easily treatable. Patients are often hesitant to take that first step toward having a cosmetic procedure or intervention. And I think that you can feel comfortable and confident knowing that we treat all of the skin and that we are the ones that can take care of any complications from other offices or medi spas, and that you could feel safe knowing that you have experts taking care of you.